And we're back with our first episode of the Healthy Dose Podcast. Welcome, I'm your host, Dr. Joe Gambardella, and your host, Dr. Buzz Korth. We're down in Miami and Columbus, Ohio. How you doing, Buzz? Happy New Year.
Great, man. Happy New Year to you, too.
Great to have you today. This is going to become a regular thing, so we're really happy to have Dr. Buzz with us. He is an expert in anti-aging therapies that include weight loss, balancing hormones naturally, growth hormone therapy, and also has a fellowship in stem cell therapy, so regenerative therapy, getting the body to heal by itself, all kinds of great things that we're going to be talking about in depth in the year to come. This is the beginning of the year, so everybody has their own specific resolutions, but one of the top ones that we hear down in the office, Buzz, is about how do I lose weight? How do I get ready for summertime? There's so many fad diets out there. Atkins is still gaining some traction, but we hear about intermittent fasting. My experience is people very rarely do it correctly. We hear about depletion diets. We hear about fasting, as I mentioned before. Let's talk about the one that we really like the most, just to kind of jumpstart people before we can do blood work and find out what diet is going to work specifically for them.
Yeah, and fasting is something you are hearing more about, Joe. But when I talk to people, it's kind of crazy. A lot of people say, "Oh, I fast," but I'll say, "Okay, well, tell me how you fast." And they're eating and they're drinking Diet Colas and they're doing other stuff. They don't understand these are things you can't do during a fast, you know. And the fast that I think we both agree upon we like the best is the 16-8 fast, which basically means 16 hours a day. The only thing you're allowed to have is black coffee, green tea, or water. No amino acids, no Diet Coke, nothing else. And then for 8 hours in that 8-hour window, then you eat a normal, healthy food, whatever that may be. That fast is very, very effective. The research shows there's lots of not only weight loss benefits, but just general health benefits. Helps with cell regeneration, increases stem cells, lots of other stuff. And the results we've seen have been amazing. And the best thing about that, Joe, and I'm sure you're going to chime in the same thing, there's no diet that's easier than fasting.
Yeah.
You know, and Joe and I both went to school together and worked out together for a long time and would, do with the diets where you eat every 2 hours, eat like chicken breast and all stuff. That's hard, man. Just not eating is really simple. And for anyone who hasn't tried it, the other thing you'll notice is the days that I don't eat, I feel amazing. It's when you start eating the food, you feel tired. Like after lunch or after breakfast, it drags you down. You get up in the morning, and usually if you sleep, I sleep 6-7 hours a night, you're already almost halfway through the fast, right?
Yes.
If you get through the day, I get up, I like black coffee or green tea in the morning, and my day flies by, and I'm super sharp. And it's really when you eat that first meal, you kind of slows down a little bit.
Yep. All the things that you just said, and in particular, is it takes a lot of stress off the pancreas. So you're releasing the insulin that you're releasing, you're able to capture much more of the glucose and sugar in the blood, put it into glands and tissues that are going to be used for energy, store some in the liver, and pretty much your body's a fat burning machine for those 16 hours during the day. And you think about the traditional diet nowadays, people are eating for 16, 17, 18 hours. So there is an enormous amount of stress on the body. You're not able to capture all of that sugar. So what's happening? You're seeing weight gain on the hips, weight gain on the thighs, weight gain on the lower abs, and you're becoming insulin resistant, and you're storing a lot of body fat and a ton of water. You're retaining a lot of water, becoming toxic.
Yeah, maybe explain insulin resistance, because that's a term a lot of people hear, but I think a lot of people are unclear on it and how it affects metabolism. But, maybe like a real quick explanation.
So what insulin is, just like testosterone and growth hormone, it's a secretion in the body by the beta cells inside the pancreas in response to the intake of glucose. Which is
carbohydrates.
Carbohydrates. So when
bread, pasta, rice.
Correct.
Sugar.
So when you take in these sugary substances, your body should release a timed amount of insulin. It shouldn't be released too quickly. It shouldn't be released all at one time. But over a sustained period of time, your body releases insulin. The job of insulin is to take sugar out of the blood, transport it into the tissues, into the muscles for energy, and also transport excess amounts into the liver in the form of glycogen to be used later for energy reserves. What happens is when you become insulin resistant, you intake these carbohydrates and your body does not release enough insulin, or sometimes it doesn't release it at all. And what happens is that glucose that stays in the blood causes increases in fasting blood sugar. We're going to see blood markers like hemoglobin A1C increase. You may notice some symptoms in addition to weight gain, like excessive thirst, increases in urination, in which cases you're functioning more like a functional diabetic than you are like a person that can easily burn fat for energy. And what that means, it's really, really difficult to lose weight.
Yeah. I think that to realize is when you're eating these carbohydrates, bread, pasta, rice, your body secretes insulin to break that down, right? But what you have to also understand, is when your insulin levels are high, your growth hormone levels are decreased, which makes it also difficult to lose fat. And one of the telltale signs you see is people start getting that abdominal fat, in particular as they get older, because of that decrease and they call that visceral fat. And that's particularly bothersome because of all the places to be fat, you don't want belly fat. Mm-hmm. Because it causes lots of organ issues and metabolic issues. And that's where we tend to put on fat as we get older because we become insulin resistant. So we're eating carbohydrates all the time. You build up fat around those organs, and that becomes a major issue.
And so there's really only two ways to handle that. Either you have to take insulin, at which time you're going to be able to regulate that blood sugar, but nobody wants to take these medications. At some point, you may have to take it as a bridge if your levels are too high, because you can do a significant amount of damage trying to regulate it on your own. If you can control it on your own, the best way to do it is by introducing fasting into your lifestyle, because you're going to regulate the amount of sugar coming into the body. You're going to be able to become less insulin resistant because you're taking so much stress off of the pancreas. One of the other things that we also see is that nowadays people are aware of taking amino acids, taking in protein, but we see excessive amount of protein being taken in, sometimes 2 to 3 grams per pound of body weight, which is excessive for a person that's not training a lot. And what happens is overnight time, your body converts excessive amounts of protein into glucose. So you're waking up, when we see fasting glucoses at 85, 90, 95, technically it's still in range, but your body's not processing enough sugar. We want to see those fasting glucose levels at about 70, 75. Taking a slow digesting protein like a casein will help with that. But the body will convert excess amounts of protein throughout the night into sugar. It's a process called gluconeogenesis. And when you do your lab work, if you notice those fasting glucose numbers are higher but in range, it's one of the telltale signs that you're going to have trouble losing weight. Most doctors won't even recognize that.
Right. And when you look in the mirror, you're going to have belly fat. Yep. And some of those symptoms is because the growth hormone levels are lower, difficulty sleeping at nighttime. There's a whole gamut of health things that are just negative on this. And really, the reality with type 2 diabetes is people eating carbohydrates all the time literally burns your pancreas out. It becomes unable to produce insulin. That's how you end up being a type 2 diabetic. And this is a disease that afflicts millions and millions of Americans at this point because of the way we eat, and it's totally preventable. 100%.
Yeah, we just saw recent news reports that they said within 5 years, over 50% of the U.S. population is not going to just be overweight, but obese. So it's going to affect you. It's going to affect somebody you love. It's going to affect somebody you work with. So we all need to know about this information. And for the first part of this podcast, just one of the big takeaways to become more efficient at burning fat and less insulin resistant is start intermittent fasting. It's very, very easy. The 16-8-5-2. You're going to have an 8-hour feeding window, 5 days a week. During
that window, let's be clear too. That doesn't mean, you break it with a pizza or a Big Mac. Be reasonable. Some good lean protein, chicken breast, turkey, maybe fish, even lean hamburger. Sensible carbohydrates. Not all carbohydrates are created equal. I always recommend people, you could look up glycemic index on your computer.
Yep.
And that'll list off carbohydrates, and you want carbohydrates to break down slower, which are lower on the index. And some of the things you might be surprised, like carrots are really high. Carrots are almost like a piece of candy. Mm-hmm. So, I've had people come in, they're overweight, and I'll say, what do you eat? I just eat carrots and fruit. If I eat really healthy, don't realize that those are converted to sugar so quick, they become insulin resistant. So, look up glycemic index and find out, and try to eat carbohydrates to break down slower so your body's able to metabolize those carbohydrates so it doesn't turn into fat and cause all these other health issues.
Yep. And an easy way to break into that as well, when people say, well, I just can't stop eating the things I love to do, life's more important than that. Save those cheat meals for the days that you're eating the one big meal a day.
Yeah.
Because during that 1 hour or 45-minute feeding window, your body's going to be able to process even those faster digesting carbs throughout the rest of the 23 hours than on the eating days when you're doing 8 hours.
Yeah, I agree with that 100%. So let's make this simple for everybody. So the 16-8 is this. So 16 hours during the day, including your sleep. The only thing you're allowed to have is water, black coffee. You can put some stevia with it, or green tea with some stevia. That's it. You're not allowed to have Diet Coke, creamers, soy milk, and nothing. Green tea, black coffee, water during that 16 hours. And I know if you've never done it, you might be saying, man, this is going to be hard. It's not hard. Give it a shot. And then the rest of the time, your other 8 hours, eat sensibly.
Yep.
And then we talked about the 5-2. So you're going to do that 16-8, 5 days a week. And then 2 days a week, you're going to eat one meal a day. You know, for me, I usually do that on the weekend because I'm busy doing stuff but I like to go out to dinner, you know, with my girlfriend on the weekend. So we'll go out and have a nice dinner that night and I'll enjoy that meal. But it's a really easy diet to follow that's going to really help you. And where I notice the most is my abdomen. I mean, I'm 50 years old and I have abs. You know, I didn't have abs when I was in my 20s because I was eating protein every 2 hours and probably had high glucose levels. This is something really easy that anyone can follow. And you're actually going to save money too. You're eating less food.
Yeah.
So it's not an expensive diet.
As we mentioned earlier, you know, right before we got on the show, Buzz, there's a couple of key things that happen along with increases in weight is that our energy plummets. We have less motivation to go to the gym, less motivation to be social. We tend to suffer at work and in relationships. There's a couple of key things that can be done to augment how we feel and how we function. Number one is you got to come in and do a blood test, because the key thing is between 30 and 40 years of age, half of the testosterone that your body produces that keeps you healthy, that keeps your muscles strong, that keeps your fat stores low, that reduces inflammation, that keeps you motivated, that keeps your sex drive elevated, leaves the body and it's never coming back. Between 25 and 30, half of the growth hormone that keeps your heart functioning, that keeps your blood vessels soft, that helps promote weight loss and depleting fat stores, leaves the body and it's never coming back. Half of the oxygen that your body uses to heal joints, tendons, and ligaments leaves the body and it's not coming back. So some of the most important keys that people come in and report to us are symptoms of those deficiencies. Why don't you list, and we touched on some of them, but some of the top ones that you see in the practice.
I mean, and I almost think, Joe, you got to be careful. I almost go to say your age doesn't matter. It's more the symptoms. I had a guy that came in today that was 27 years old. And if you looked at him, he looked pretty healthy. He's an Army sniper, just got back from sniper school and got through that, which is, you know, it's a pretty big accomplishment. But was just dragging, tired all the time. We did blood work on him. His free testosterone was 7. This is a guy that's 27 years old, you know, eats healthy, you know, is a military guy. A 7, that's like the testosterone level of a, you know, 60 or 70-year-old man. So, you know, if you're listening to this podcast, I really don't care what your age is. If you're, you know, lacking energy, have difficulty sleeping at nighttime, not motivated, go get blood work done, because the blood work never lies.
Yep.
You know, if it's not your, and it could be maybe you're vitamin D deficient, maybe you're estrogen dominant. Like, it doesn't have to be low T, but the blood work doesn't lie. We're going to be able to look at that blood work and say, why don't you feel like you should?
And just what you were saying right now, that free testosterone is such an important number. If you said that gentleman that came in to see was at a 7, he was in the lower 25 percentile. That the free testosterone for the healthy functioning male should be between 28 and 32. Yeah. For females, the same thing applies. You know, 3.5 to 4 is where most women's free testosterone needs to be. And doctors don't ever test free testosterone in females.
Well,
I've never seen a patient come
crazy.
in. Yeah.
You know, I mean, here's what happens. So let's talk. So this guy's, you know, 27 years old, doesn't have energy, not motivated. If he goes to a doctor who doesn't specialize in what we do, a lot of doctors, and I hear it all the time. I went to my doctor and said, I'm too young. I can't have low T. Maybe I have depression. Mm-hmm. Because the symptoms of low testosterone and depression are mirror images of each other.
Yep.
So I'm going to pose this back to you. How many people out there on depression medications that really aren't depressed, but maybe they have low T? And instead of taking a drug that alters your brain chemistry, and I'm not saying depression's real, so I'm not debating that. but I think it's way overdiagnosed. And the reason it's overdiagnosed is to manage an HRT case like we do at your facility or my facility, the Mirror Images, a standard doctor's office can't do it. It doesn't fit the normal medical model because there's lots of oversight, there's lots of retesting, there's lots of one-on-one time we spend with the patient in those labs. It just doesn't fit the regular medical model. Where giving someone a Wellbutrin or some type of depression medication is real simple. Just take this, and if you feel better, great. If not, come back and we'll give you a stronger one. Like there's no management with it. So, and I'm not slamming doctors, but it's just not set up with our typical medical system or medical model the way it is now. It's easier to treat depression or what they perceive as depression than it is to handle the hormone imbalance.
Yeah. And there is still, to some degree, there's hormonophobia, right? Doctors are not well informed enough about this topic. One of our teachers, Dr. Abe Morgenthaler out of Harvard University, that set up Boston Medical, one of the premier establishments for treating hormonal decline in men and women, really came out with some pretty specific information about this. There's been numerous studies about the efficacy and safety of testosterone. Dozens and dozens and dozens of studies have come out supporting this. Over the years, there's been maybe 4 studies that talked about testosterone supplementation causing or leading to an increase in coronary episodes. That could have been heart disease, heart attack, or stroke. Dr. Morgenthaler, being one of the geniuses that he is, looked into these studies that came out. And what they found was that one of the studies that published information not supporting the use of testosterone to treat coronary deficiencies or cardiac ill health was conducted with a methodology that was very, very rarely used in clinical case studies. And what they found is when people were tested regarding the efficacy of treatment, people who had adverse events from taking testosterone were counted as more than 1 in this randomized study. People who had positive results, meaning they had fewer episodes of heart disease, fewer incidents of heart disease generally speaking, but specifically less heart attack and fewer episodes of stroke, were counted as less than 1. So when the data was actually analyzed correctly, 60 to 80% of the people that supplemented with testosterone had lower cause mortality, had fewer heart attacks, and less stroke. So it was overwhelming evidence that improves the safety and efficacy of taking this, not only to support cardiovascular health, but to improve libido and overall well-being.
Yeah, I mean, undisputed. I always tell patients, you can do it just back to common sense. If testosterone caused heart disease, then every teenage boy would have heart disease. Or if testosterone caused prostate issues, then every teenage boy would have prostate issues. So, So there's no logic to saying testosterone causes prostate issues or heart disease. It just doesn't make any sense. And there's no clinical rationale.
Yep. And on one of the shows we had a couple of months ago, we had Dr. Efrain Gonzalez, who was the former chief of medicine and the former chief cardiologist over at Baptist Hospital. It's the biggest hospital group down here in South Florida. And he said it very, very, very eloquently in that when he does cardiovascular surgery, when he's doing heart valve, evaluating heart valves, when he's doing open heart, he said, Joe, when people bleed, I can't wait 180 days for them to make new blood for their body to recover and heal. So what do? We have to transfuse blood in. Very simple. Everybody understands that. When someone is anemic or they're too low in blood volume, you have to bring new blood in. It's uncontested. Mm-hmm. But when hormones are low and you can't produce enough of them, why the controversy to bring more in? He said it's very easy. The older you get, the less you make, the more you need. So you have to bring more in, plain and simple, but you have to bring the right type of hormone in. There's a big difference between bioidentical hormones and synthetic hormones. Buzz, I know you speak about this frequently. How can we wrap this up to get people to understand about bioidenticals versus synthetics?
Yeah, that's a great question. So and to make things even simpler, Joe, so what people have to understand, the purpose of your hormones is how your cells communicate. It's that simple. It's your endocrine system, your testosterone, your estrogen, even your growth hormone. Obviously, if you have less hormones, you have less intercellular communication. So let's say you take Navy SEALs. You put Navy SEALs into combat. These guys are super highly trained. They're born for this. but you don't let them do hand signals or talk on walkie-talkies or even look at each other. How effective are they going to be in combat?
Not effective at all.
That's the same exact thing that's happening to your body when your hormones are deficient. Your cells cannot communicate and you break down with age. And I've even heard it posed, as you get older, your hormones decrease, or is it because your hormones decrease, that's why you get older? Mm-hmm. Interesting question, right?
Yeah.
So, and the difference in what we do is we only use bioidentical hormones. So what that means is the hormones we use are the identical chemical structure to what your body produces. And that's very significant compared to a steroid, which is synthetic and is not identical to what your body produces. So although it might give you some of the same reaction or response, the body knows it's different. It's kind of like a key when you put it in a car. Mm-hmm. One little difference in that key makes the difference between the tumbler working and the tumbler not working. Hormones are the same way. If you're not using bioidenticals and using something synthetic like a steroid, like an Anadrol or an Anavar, I'm just trying to think of some other non-bioidenticals.
Methyl testosterone, Premarin, Provera, all of these different things.
Yeah, it's not identical. So although it's a drug that can treat the symptom of hormone deficiency, because it's not the exact bioidentical hormone, there's always going to be a side effect every single time. And I think, good one you gave it was Premarin, right? So when females go through menopause, it's terrible because males lose their hormones 3 to 5% a year after age 30, but it could be sooner. So it's very slow. And a lot of times guys don't realize they're messed up until they hit 50 and say, man, I feel like garbage. I'm sitting on the couch and all my joints hurt. Maybe I should get my hormones checked out. Females, you got to imagine when they hit 40 or whenever they hit their menopause, that whole process, instead of happening over 10 years, happens within a year. Hot flashes, they're miserable, So they go to their doctor and say, hey, I'm having hot flashes. And the doctor's like, oh, okay. You have, that's a lack of estrogen. That's why you have hot flashes. So we're going to put you on estrogen. They give them this drug called Premarin. Premarin is not estrogen. Premarin's a drug. Premarin's actually made out of horse urine. 50% of it is E1, which is estrone, which they call old lady estrogen because it causes saggy boobs and saggy skin. No one wants that, right?
Right.
But the other 50% of this Premarin is literally horse estrogen, which your body doesn't recognize. And it causes side effects, one of which is called cancer. Mm-hmm. Okay. So you might be saying, okay, so Dr. Joe, why would my doctor give me a drug that causes cancer? It's because it's patented and there's money behind it. You're not able to patent a bioidentical. So the estrogen that females use, we use a combination of E2 and E3. Mm-hmm. You can't patent that. There's no money in it. Big Pharma's not behind it. And what you also have to understand is the medical schools at this point are run by Big Pharma. And the majority of continuing education that physicians are going to go through, if they want it covered and they want to go to a nice country club, is going to be sponsored by a drug company. And the drug companies are going to talk about the drugs. They're not going to talk about bioidenticals. Mm-hmm. So your physician's not doing you wrong. They just don't know the right path. It's that simple. And I know yourself, we both, paid for our continuing education. It wasn't free. We did our fellowship to the American Academy of Anti-Aging and the Metabolic Medical Institute. But we learned the truth. And the truth is what the body makes is always better than what man creates. Why not put back in the body exactly what the body produced?
Yeah.
It's that simple.
Yep. And that goes across the board, whether it's testosterone, whether it's producing enough growth hormone to keep the body healthy, to keep the body youthful. Make no mistake, whenever you go to a gym or you see people in the movies that look the way you want to look, they're doing something similar to the things that we're talking about. But I hasten to say they may not be doing it all the natural way. They may be using some of the synthetics. The things that we're talking about are going to enable you to get the results that you see on TV. They're going to be able to look the way you want, but you're also going to be doing it safely, and you're going to be doing it for a very, very long time because you're lengthening your lifespan and protecting your overall health.
Yeah, at some point, everyone needs to make a decision. I tell all my patients this. You're either going to be okay with getting old, or you're going to fight the fight. And that's your choice, right? Yep. And if you choose to get old in age and have, arthritis and no energy, you're not wrong. That's your choice, right? And I can't tell someone how to live their life. But I can also tell you that I'll be 50 in February and I'm in my lifetime best shape. And I'm not saying that to brag, but I'm saying it because it's possible.
Mm-hmm.
You know, I work out every day. I sleep great. I have tons of energy. I have two young boys. I can go hang with them, and I work out with my 16-year-old son at the gym every day. And I have no joint pain whatsoever. So this is something that's real and possible for anyone that wants to do it, and it's not expensive.
Yep.
We're not talking about pharmaceuticals that are very expensive, hormone replacement therapy, growth hormone boosting peptides, even allografts that contain stem cells. These are things that are affordable because they're not patented and run by big pharma. Anybody can afford them. Anybody.
And it's up to us, the trained doctors, to just find out which ones you need. And we do specific blood work to find out what your hormone levels are, what your nutritional deficiencies are. We test many, many different vitamins, vitamin B12, vitamin D, just to give a few examples. I think one of the things that we should touch on, Buzz, is because a lot of people do get blood work, but the blood work that we do encompasses many, many more things than a traditional standard panel. And I do want to also touch upon the difference between evaluating a blood work when you're an anti-aging doctor versus when you're just a general physician. More specifically, the difference between
people come in, I'll say, blood work done. They'll say, oh yeah, I have my yearly physical. They did everything, and my doctor said my blood work's fine. Well, if you're not going to an anti-aging specialist, they're not looking at the same things we're looking at. And more importantly, what normal testosterone levels are what, I think, at this point. They just dropped normal testosterone, by the way.
Yeah, 258 to 1197.
Yeah, and that just went down because testosterone, because of our environment, is decreasing with time, right?
Mm-hmm.
So as long as you're in that window of, what do you say, 250 to 1100, they say you're normal. Obviously, there's a huge difference there, right?
Yes.
And if you're around that 250 or 260, trust me, you're not going to feel a tenth of what you feel like at 1,000.
Yeah. And the optimal range is around 900. 900 is kind of where we shoot for. And then, as we mentioned before, 28 to 32. Those are some numbers that you could write down, free testosterone levels, to feel the way you want to feel, to be 50 years old and be in your lifetime best shape. I'm sure those are where your numbers are, Buzz.
Yep. Yeah. Yeah. And what does that mean? So that means no joint pain. That means when I sleep, I go to bed, I fall asleep in about 5 minutes, and I don't wake up at nighttime. When I work out at the gym, I don't get injured. If your testosterone, like that guy that came in today, his level was 7, he can't work out because if he works out, he's going to get injured. His body can't recover. So if you're sitting here saying, man, I like to work out, but my knees hurt, my back hurts, it's probably because your hormones are messed up and your body won't recover. And the wrong thing to do would be to go work out with messed up hormones because you are going to get injured. So before anyone starts a workout routine, especially as you get older, get your hormones checked out, because the worst thing you can do is go to the gym and hurt yourself because you're not able to recover. That doesn't make any sense.
Yep.
It's counterintuitive, right?
Yep.
Start jogging. Your knees will kill you. Your feet are going to kill you. Get your hormones balanced out so you can actually have the opportunity to recover, because working out is breaking down the recovery, right?
Yes.
But if you break down and don't have the ability to recover, all you're doing is breaking down. That might help our chiropractic and physical therapy business, but it's not going to do the person any good.
Yeah.
Yep. That's the reason we really got into what we're doing. My story is our offices are mirror images. We started out as chiropractic offices and added physical therapy. But there were certain people that no matter what type of chiropractic or physical therapy they did, they weren't getting better. And I knew there had to be more to it. And in my situation, I personally had plantar fasciitis that wouldn't go away. I was doing all types of therapies and it'd get better, but my plantar fasciitis kept coming back over and over and over. And I had the best tools that were known. Got my hormones checked out and started doing bioidentical hormone therapy, and my plantar fasciitis went away and never came back.
Yeah.
Right then I was like, man, there's something to this whole thing, right?
Yep.
So if you're sitting listening to this and you've been going to the same chiropractor with the same back pain or physical therapist with elbow pain for year after year after year, and it keeps coming back, the reason it's coming back is you're not recovering. And you got to dig a little deeper. Look at the body as a whole. Why wouldn't your body recover properly? Hormones is the best place to start. When someone comes to me with fibromyalgia, or we do lectures all the time, and what hurts the most? Well, my back, my knee, my shoulder, my elbow. I stop the press right there. If everything hurts, you're not recovering. Let's get a hormone panel.
Yep. And a lot of people think, well, I'm just getting older, and it's like you said, if it was getting older and if it was arthritis, why does it just affect one joint? It would affect multiple joints. Arthritis, as we mentioned or we're talking about, can really attack a weak spot in the body. You have to look at the overall structure. But I think it's an excellent point that you just made. If you hurt all over, chances are it's not arthritis, it's hormonal deficiency. Really, really good takeaway from the podcast today. If you hurt all over, get your hormone levels checked. If you don't hurt all over and you want to know if you're healthy, are going to be healthy, or are going to benefit from any type of workout plan or any type of diet, you got to get these things checked. You have to know what your baseline is to find out if you need it or not. Secondly, just to digress, beginning of the year, everybody wants to lose weight. If you want to lose 10 pounds within a month without altering your diet significantly, the intermittent fasting of the 16-8-5-2, extremely effective, extremely important. More importantly, easy to follow. Easy to follow.
So easy. It's easiest diet there is.
So let's give somebody the challenge, right? The January challenge. By the end of the month, we want to have 10 pounds less, most of that being lower body fat. And we also want to be on the road to picking out a workout plan that's going to make your arms bigger, your chest bigger, waist smaller. For women, ponytails thicker, face raised, breasts raised, right? Checking out those hormone levels is a really good place to start. And on our future podcast, Buzz, we're going to go really into the specifics of, as you mentioned earlier, all the different types of estrogen, which ones get replaced, which ones never do. Testosterone, equally as important for females as it is for males. In fact, the easiest thing to treat. We're going to talk about allograft containing stem cells. How do you get knees to heal, backs to heal, shoulders to heal, that never will by themselves once they're injured. All safe, all clean, all effective, and all affordable for everybody. We have a lot to talk about this year. I'm glad to have you co-hosting. We're going to be having a lot of great guests coming up. I know you have a lot in your pipeline, so do I. I want to give our audience that are listening out there right now the chance to call our office. I want to give you the floor, Buzz. If you're in the Midwest, I'm not just talking about in Ohio. It's worth driving. It's worth flying into Columbus, Ohio to visit Buckeye Physical Medicine. Buzz, how do people get in touch with you up there?
The best way is you can go right to the website, which is buckeyepmr.com. Check us out on the website. It talks about all our services. We check those emails all the time. If anyone has any questions, you can email me. My email is pretty simple too. It's just drbuzzk@gmail. That's my personal email. I'm pretty good about responding right away. So buckeyepmr.com, or you can email me directly at drbuzzk@gmail.
Excellent. And if you are on the East Coast, Southeast, Advanced Physical Medicine and Rehab is our mirror image practice down here in Florida. We treat people all over the country. People fly in to see us. People come from New York, New Jersey. We've had some people up, even in Canada, that have come down to visit us pretty frequently. APMR Miami is our Instagram handle. apmrmiami.com and miamidiscenter.com is where you can find out a ton of information about our practice, what we do to treat people with low energy, back pain, neck pain, and all those great things that you want to improve for this coming year. Our phone number here at the office is 305-598-8788, and our email is office@apmrmiami.com.
Excellent.
Buzz, we're going to see you in a week. We're going to be sending out some information on our YouTube channel and on our Instagrams about who our upcoming guest is. Check the link below. Visit our YouTube page. We're really excited about this coming year.
Yeah, thank you, Joe. I appreciate it. It's going to be fun.
Okay, Buzz. Yep. Repair, recover, regenerate. We're going to see you next week.